Your blood pressure has been creeping up for years. Your doctor mentioned it at the last checkup. Maybe they even put you on medication. And then, nothing. No symptoms, no feeling. Life goes on. So you push it out of your mind. But here's what catches most people off guard. High blood pressure doesn't announce itself. It doesn't give you a sign that says danger ahead. It just works quietly in the background, potentially damaging the organ that depends most on healthy blood vessels, your heart. And even stranger, you might already be experiencing warning signs right now. Not a heart attack warning, not a stroke warning, but signs that your heart is starting to feel the strain. It just works quietly in the background, potentially damaging the organ. Signs you've probably noticed a dozen times and completely dismissed as just getting older, or stress, or I didn't sleep well. Today, we're going to walk through 8 of those warning signs, not to scare you, but to help you recognize the difference between normal aging and something that actually deserves a conversation with your doctor. Because catching the pattern early is how you protect yourself. Let me start by being honest. High blood pressure is called the silent killer because it usually doesn't feel like anything. You can have dangerously elevated blood pressure for years and genuinely not notice. No pain, no dizziness, no sense that something's wrong. But, and this is important, sometimes your heart and blood vessels do send signals, subtle ones, the kind you might notice once or twice and think, that's weird, and then move on with your day. The trouble is, most people don't know what to listen for, so either they panic at something totally normal or they miss something that actually matters. The good news is, if you understand how high blood pressure damages the heart, these signals make sense. And you can actually learn to tell the difference between this is fine and this is worth mentioning to my doctor. That's what we're diving into today. We're going to talk about what happens inside your body when blood pressure stays high for too long, and then we'll walk through 8 signs that your heart might be starting to struggle. By the end, you'll know exactly what deserves your attention and what you can probably ignore. So let's start with the basics of how this actually works. When blood pressure stays elevated, your arteries, especially the tiny ones that feed your heart, have to deal with constant extra force pushing against their walls. Think of it like putting a garden hose under too much pressure for too long. Eventually, the hose starts to weaken. It doesn't fail all at once. It develops tiny cracks. It gets stiff and loses flexibility. That's roughly what happens to the coronary arteries that supply blood to your heart muscle. The repeated force causes inflammation in the artery walls. The lining gets damaged. Your body tries to patch the damage, but the patches, made of cholesterol and fibrous tissue, build up. That buildup, we call it plaque, narrows the artery. And a narrower artery means less blood flow. Less blood flow means less oxygen reaching the heart muscle. At the same time, the heart itself is working overtime. Every beat has to push blood against higher than normal pressure. Imagine carrying a heavy backpack all day, every day for years. Constant strain causes it to thicken and stiffen. That thickening, called left ventricular hypertrophy, sounds clinical, but what it means in practical terms is your heart's chambers get smaller, less flexible, less efficient. It has to work harder to do the same job. This is all happening silently, usually without any feeling at all. But sometimes, and here's where today's 8 warning signs come in, your body does give you clues. Not a siren, not a pain that doubles you over, but signals that the heart is under strain. And that's where most people get confused, because these signals often feel very mild, very dismissible. They feel like things that happen to anybody. But if you're getting dizzy almost every time you stand up after sitting for a while, that starts to matter. That suggests your heart and your blood pressure regulation might not be bouncing back the way they should. That's the theme running through everything we're about to talk about. We're not looking for dramatic symptoms. We're looking for patterns that suggest your cardiovascular system is struggling more than it should be. Here's where it gets interesting. Not everyone with high blood pressure will develop heart damage, and not everyone who develops heart damage will show obvious signs early on. But the people who stay aware, who notice changes in their body, who work with their doctor to manage their blood pressure, those people have a much better chance of catching problems before they become serious. So let's walk through the 8 signs, and we'll start with the ones that might seem the most ordinary. Warning sign #1. Unusual shortness of breath during normal activity. You've probably noticed this one. You're walking up the stairs in your house, or you're going for a slow walk around the neighborhood, and you feel a little winded. Nothing extreme, just you're breathing a bit harder than you remember you used to. Now, it's completely normal for your aerobic capacity to decrease a bit with age. But here's what you should pay attention to: a change from your baseline. If you've always been able to walk upstairs without thinking about it, and now suddenly you're noticing you're short of breath when you get to the top, that's a change, and changes matter. Why does this happen? When blood pressure stays high and the heart has to work harder, the heart muscle gets stiffer. That stiffness means the left ventricle, the chamber that pumps oxygen-rich blood to your body, doesn't relax as easily between beats. Blood backs up into the lungs. Fluid can even start to accumulate in the lungs. When there's extra fluid in the lungs, you might notice you're not as winded if you slow down, take it easy, sit down and rest for a moment. And that's often a tip-off that this is heart-related rather than, say, a respiratory problem. So here's what to track. Is this new? Have you noticed it more in the past few months than you used to? Are you having to slow down during activities you used to do without thinking? If you're noticing a pattern, not just one time, but multiple times, that's worth mentioning to your doctor. Especially if you've already been told you have high blood pressure or your family has a history of fatigue that doesn't match your routine. You're not training for a marathon, you're not working a 14-hour, more tired than makes sense for what you've been doing. This one is tricky because fatigue is also a sign of 100 other things: sleep apnea, depression, anemia, thyroid problems, not sleeping well, stress. So by itself, one day of feeling exhausted doesn't mean anything. But if you're noticing that you're consistently more tired than you used to be, even on days when you've had enough sleep and you haven't done anything particularly demanding, that's worth noting. When the heart isn't pumping efficiently due to hypertension damage, less blood reaches your muscles and brain. Your tissues aren't getting quite the oxygen and nutrients they need. Your whole body feels sluggish. People often describe it as running on half a battery, or like I'm moving through mud. The distinction that matters: is this new? Is it persistent? Does rest or sleep seem to help less than it used to? Pair this with one of the other signs we're talking about today, and it becomes more significant. Warning sign #3, swelling in your ankles or feet. One day you look down and your socks have left a dent in your ankles, or your shoes feel tighter than they did this morning, or when you press your thumb into your skin, it leaves an indent that takes a few seconds to bounce back. Swelling is especially easy to dismiss in the summer. I've been standing all day, it's hot. And honestly, sometimes swelling really is just from standing too long or the weather. But persistent swelling, especially if you're seeing it at the end of the day or first thing in the morning, can signal that your heart isn't pumping blood efficiently back up from your legs. Fluid accumulates in the tissues. This is called edema, and it's one of the body's ways of saying the blood's not moving as well as it should. If you're noticing swelling that's new for you, that happens even on days when you've been resting, or that doesn't go away when you elevate your feet or wear compression socks. That transition hook. These first 3 signs are the kind that might feel gradual, almost like you're just getting older, but the next 3 are more noticeable. These are signs that your body is really starting to work harder to keep up. Warning sign #4, chest discomfort. Now let's be very clear about something. Chest pain can mean many things. It can be heartburn. It can be muscle tension. It can be anxiety. And yes, it can be a sign that your heart isn't getting enough blood. The reason I'm bringing this up specifically in the context of high blood pressure and heart damage is because plaque buildup in the coronary arteries from years of high blood pressure can restrict blood flow to the heart muscle. These first 3 signs are the kind that might feel gradual, almost like you're just getting older. When you exert yourself, your heart needs more oxygen. If the arteries are narrowed, the heart doesn't get what it needs. That mismatch between demand and supply creates a sensation, pressure, tightness, or heaviness in the chest. Here's what distinguishes this from other kinds of chest discomfort. It often comes on during activity and goes away with rest. It might feel like something is sitting on your chest, or like a dull ache rather than sharp pain. Some people describe it as pressure, others describe it as heaviness. You might also notice shortness of breath at the same time. And here's something important. This can be mild. It doesn't have to be the crushing, dramatic chest pain you see in movies. Sometimes it's just a sensation you notice, and then it goes away, and you think, that was weird, and you move on. But if you experience chest discomfort, especially if it's new, if it comes on during activity, if it's accompanied by shortness of breath, or nausea, or unusual sweating, or if you have any doubt at all, call your doctor. Don't wait for it to happen again. Don't assume it's nothing. Get it checked. We'll talk about emergency care in a moment, but the key right here is chest discomfort deserves professional evaluation. Warning sign #5, heart palpitations. Most of the time, you don't notice your heart beating. It just does its job. Or you become aware of your pulse pounding in your neck. This can happen for many reasons: caffeine, stress, anxiety, dehydration, exercise, completely normal. But when your heart is struggling due to high blood pressure damage, palpitations can become more frequent. The heart might beat irregularly. You might feel your heartbeat in your chest, your neck, or even in your ears. Some people say it feels like their heart is skipping beats or fluttering. Again, one palpitation event doesn't mean anything. But if you're noticing them more often, especially if they're happening at rest or in situations where they didn't used to happen, when you're sitting calmly at home, for example, that's worth tracking. And if palpitations are accompanied by dizziness, shortness of breath, or chest discomfort, that's when you need to reach out to your doctor sooner rather than later. Emergency note: if you experience chest pain or pressure accompanied by shortness of breath, nausea, sweating, or pain radiating into your arm or jaw, especially if it's new or severe, call emergency services immediately. Don't drive yourself. Don't wait to see if it passes. This could be a heart attack, and the first minutes matter. But there are also 3 more subtle signs that show up when blood pressure has been high for a long time. And these can sometimes be even more telling, because they're the ones people almost never connect to their heart. Warning sign #6, dizziness or lightheadedness, especially when standing. You stand up after sitting for a while, and the world spins for a second, or you feel lightheaded, like you might faint. It passes quickly, usually in a few seconds, so you shake it off and keep going. This happens because when you stand up, blood has to rush up against gravity to reach your brain. Your blood pressure regulation system is supposed to adjust instantly. Your arteries tighten slightly, your heart rate might speed up a bit, and more blood gets pushed upward. This whole response is automatic. It's called orthostatic regulation, and it happens in the blink of an eye. But when your blood vessels are stiff from years of high blood pressure, they don't adjust as smoothly. And when your heart's ability to pump efficiently is compromised, it takes longer to get blood where it needs to go. Result, you feel lightheaded for a few extra seconds while the system catches up. Now, this is incredibly common in people over 60 and 70, and often it's nothing to worry about. But if you're noticing this happening more frequently, if it's getting worse over time, or if it's accompanied by other symptoms like chest discomfort or palpitations, that's worth mentioning. The practical thing you can do: stand up slowly. Give your body a few seconds to adjust. Hold on to something. Stay hydrated, and track whether you're seeing a pattern. If you are, mention it to your doctor. They can check your blood pressure lying down and standing to see if your regulation system is struggling. Warning signs: or they lie down and suddenly feel anxious or short of breath, which makes sleeping difficult. This one comes from fluid accumulation in the lungs. When you lie flat, gravity's not helping your heart push blood back up from the lower body. Fluid that's been settling in your legs during the day can shift into your lungs. That's when you might feel short of breath. Some people even wake up gasping for air, a condition called paroxysmal nocturnal dyspnea, which is exactly as scary as it sounds if you experience it, but it's a sign you need to tell your doctor about. This is different from normal sleep problems. Normal insomnia: you toss and turn. You can't fall asleep. You wake up and can't get back to sleep. Heart-related sleep problems specifically involve breathing difficulty, especially when you lie down or when you wake during the night. If you're noticing you can't sleep flat anymore, or that you need extra pillows to prop yourself up, that's a signal. Warning sign #8, unexplained weight gain. You haven't changed your diet. You haven't become sedentary, but over the course of a few months, you've gained 5 or 10 pounds and you're not entirely sure why. Unexplained weight gain, especially sudden gain, can be a sign of fluid retention, when your heart isn't pumping efficiently. If you step on the scale and notice a rapid gain, a few pounds over a few weeks without obvious cause, that's when you note it. So you've gone through 8 warning signs. Maybe you've checked off none of them. Maybe you've checked off 2 or 3. Maybe you found yourself in every single description, and now you're wondering if your heart's already failing. Let's pause on that anxiety right here. The presence of one or even several of these signs doesn't mean you have heart disease, And it definitely doesn't mean it's too late. What it means is there are enough red flags in this pattern that it deserves a conversation with your doctor. Here's the honest truth. I can't tell you whether these signs mean something serious is happening with your heart. No one can tell you that except a doctor who knows your full medical history, who can examine you, and who can order appropriate tests. But here's what you can do right now, today. First, track what you're noticing. Not obsessively, just start paying attention. If you feel short of breath during an activity you used to do easily, note it. If you wake up gasping, mention it. If you notice swelling that wasn't there before, track it. Don't panic about individual moments. Look for patterns. If you've already been diagnosed with high blood pressure, you should be seeing your doctor at least once or twice a year anyway. Use that appointment to mention what you've noticed. Bring a simple list if that helps. I've noticed I get short of breath faster than I used to, or I wake up sometimes feeling like I can't catch my breath. Your doctor will ask questions, take your blood pressure, listen to your heart and lungs, and probably order an EKG or an echocardiogram. Those are simple tests that show exactly what's going on. Third, don't self-diagnose. You might read about something online and convince yourself you have heart failure or coronary artery disease. You might read something else and convince yourself it's all fine and you don't need to worry. Neither is helpful. The information here is meant to help you recognize what matters enough to tell your doctor about. That's it. Fourth, if you experience severe chest pain, shortness of breath that doesn't get better with rest, chest pain with sweating and nausea, or fainting, call emergency services immediately. Not urgent care, not your doctor. Emergency services. These could be signs of an active heart attack or other serious event, and the first hours matter. Monitor your BP at home if your doctor recommends it. Adjust your diet if your doctor suggests it. These are the actions that actually prevent heart damage in the first place. The goal here isn't to scare you into panic. It's to help you become the kind of person who listens to their body, who tracks patterns instead of dismissing everything as just aging, and who partners with their doctor to catch problems early. That's actually the difference between people who have high blood pressure and age healthily, and people whose high blood pressure becomes a major health crisis. The healthy agers are the ones who stayed aware. So, let's bring this together. High blood pressure is silent. It can damage your heart without you feeling a thing. But sometimes, in subtle ways, your body does send signals. Shortness of breath, fatigue, swelling, chest discomfort, palpitations, dizziness, sleep problems, unexplained weight gain. None of these by themselves prove something serious is happening. But together, or in patterns, they're worth attention. The 8 signs we talked through today aren't meant to be a checklist that determines your doctor. And if you've been noticing any of these, especially if you know you have high blood pressure, schedule an appointment. Have that conversation. Your heart has been beating for decades without you thinking about it. It deserves that conversation. You deserve to know that it's strong and healthy, or if it needs support, to get that support now while you can. Thanks for sticking with this all the way through. If this helped you understand your body a little better, please hit that subscribe button so you catch videos like this one. And leave a comment. Let me know which of these signs surprised you, or if you've experienced any of them. Your experience helps the community learn. Take care of yourself, and if you're noticing something that's got you worried, reach out to your doctor today. That's the move.